And we're just going to get going as people can join as they join. I know it's like right after school time, so if they come on late, that's not a problem at all. So my name is Maria Vigil. I am the Career Connected Learning Program Manager at Greater Spokane Incorporated, which doesn't tell you much and it's just a really long title. But my job is to help connect students to hands-on, which is a hard term to use right now in our virtual world, but hands-on opportunities to learn about careers and career pathways and how best to get to their goals as far as entering the workforce goes. So our business after school programs are generally in person. We had hopes for this one, but it just wasn't going to happen. So hopefully starting up next fall, we can get back to them being in-person workshops, but for now we're keeping them virtual just for everyone's safety. We just welcome everyone for joining. Thank you all so much for taking time out of your day, and for our panelists as well from UW School of Medicine taking their time to share with us. So I'm going to pass it off to them. I'll be monitoring the chat if anyone has any questions. I'll say this, they'll probably say it again as well. Any question you have, just pop it. You can either use the Q&A function or the chat. It really doesn't matter. We'll be monitoring both. Or if you really want to ask yourself, go ahead and raise your hand. We probably won't get to questions until towards the end, but they will get answered one way or another. But as they come up, feel free to just stick them in the chat so you don't forget. I am going to put up a quick poll if you wouldn't mind answering, just so we can kind of get an idea of who all is here. So that should have popped up for you. If you can just pick kind of which best represents you out of all those categories, that would be great. Perfect. So it looks like a bulk of the people here are high school students, which is perfect. This is also open to middle school students. It really is open to everyone, especially now that it is virtual, our community partners, and of course, teachers and parents as they learn how to best support their students. So thank you for answering that for me. I'm going to end that poll. I might relaunch it later if we get a lot more people on, but for now, I'm going to mute myself, turn off my camera, and pass it on.
Alrighty, I am going to share my screen. So hello everyone. Can everyone see that? Or Brenda, could you give me a thumbs up?
Yeah, that looks great.
Sweet. Well, welcome. So kind of the purpose of this event, or how it's going to go, is the first 30 minutes, I'm just going to kind of walk you through our general schedule and then do a really fun case presentation with you guys, kind of going through a hospital patient that we would interview as med students and kind of have you involved with that. And then for the second half, Brenda's kind of gonna go more into the application process, things that you can kind of do as high school students to prime yourself for a career in healthcare, or just like get more interested and get more exposure. So I'm gonna start here and I'm just gonna share my presentation with you. So this right here is our weekly schedule. So this is kind of what it looks like. In pink, we have my lectures, and in purple is our foundation. So that's going to be where we're actually interacting with patients and getting like hands-on experience, which is really fun. So as you can see on Tuesday, that's like our hospital tutorial. So that's when I'd be going into the hospital with my white coat, with my mentor, and kind of interviewing a patient and hearing their story. So we're going to kind of get a lot more in depth with that later on. And then in this week in particular, we had anatomy lab a lot. And so that would be on the Wazoo River Point campus in Spokane. So as you can see, even though it is a bit busy, we do have good chunks of free time to kind of have a good work-life balance, you know, go hang out with friends or get a good workout in or things like that. And this is our second week here. So that big purple chunk is actually our primary care practicum. So once every 2 weeks, we go into a primary care clinic and we have a preceptor who is a primary care physician. And we go in and we get to interview patients on our own and work with the primary care provider to create like treatment plans for these patients. And so as like first year medical students, it's actually really exciting because we do get a lot of kind of early exposure and early clinical exposure, which is really great. And then once again, all of our lectures and our exams. So you can see we have a lot of small group learning on top of lecture-based learning. So the small groups are really great because we get to kind of work in teams with our classmates. And sometimes we'll have like dental students for FCM workshops come on. So it's also pretty interprofessional. And as you can see, once again, this week's a little bit busier, but we still have a decent amount of free time after and before class to do things that we'd like to do. Brenda, do you want to add anything on to that?
No, yeah, I think that with the schedule, it's busy, but you also have time to kind of like balance what you want to do and figure out your study time and your study habits that will help you succeed. So yeah, that's what I would add.
Sweet, thank you. Yeah, so we're gonna go right into it because I think for me as a medical student, one of the most exciting things to do is go into I actually go into Sacred Heart Hospital and I will interview a patient there. So I'm gonna take you all in as medical students, and it's our first time going to the hospital to interview a patient. And so just going based on that, before going into the patient's room, your mentor asks you, what do you think are some important questions to ask the patient? So you can say these out loud, you can put them in the chat. And it can be as general as like, what are you here for? So if you can think of anything along those lines, name, age, great. And also you can chat to me privately if you don't want to be put on the spot. Yeah, how are you feeling? Perfect. Any medical conditions? What brings them in? Lovely. Yes. Symptoms, questions they have. What's your illness? Yeah, these are all really great. Any past good? Anyone in their family? Medication. Wow, you guys are like covering all the bases. Sign paperwork. Yeah, sure. Medications they're taking, underlying conditions. Yes, all good things. These are fantastic. So yeah, and this is honestly the first, if they can afford things, perfect. Anyone with COVID in the family, that's a great point, because actually when we were starting to shadow, COVID was a big situation and all the patients were getting tested for COVID and we had to be really careful and wear like face masks and our face shields on top with goggles. How long have you been feeling this way? Perfect. Any allergies? Yes. So these are all things that are very important questions to ask. And I think you all are ready to be medical students, because some of these things I wouldn't have even known to ask before starting. So yes, perfect. Those are all great questions. Thank you for participating. Yes. So, oh, hi.
Before we move on, there was a question if we can introduce ourselves. So do you want to do a quick intro?
Oh, yeah. Oh my gosh. Sorry. I was like way too excited. Brenda, you can go first.
Okay. Hi, everyone. My name's Brenda Fleshman. I'm a first-year medical student at the University of Washington School of Medicine in Spokane. And yeah, Apoorva, go ahead.
Sure. My name is Apoorva. I'm also a first-year medical student at UW School of Medicine in Spokane. Brenda and I both went to UW Seattle for undergrad as well, if you have any questions about that. I grew up in Kent, Washington, but I have moved to Bellevue since, and then I live in Spokane during med school. So, and Brenda, do you want to say where you went?
Yeah, I'm originally from Othello, Washington, and then moved to Seattle for college, and yeah, and I also wanted to, I had something, I guess it's not important because I can't remember it, but yeah, go ahead, Apoorva, sorry.
No, there was two more questions. So what medical field do you guys want to go into, and what did you major in for undergrad? Sure. So I majored in biochemistry. I'm kind of interested in a lot of things right now. I think family med is really cool. I think ophthalmology is really cool, which is like an eye doctor, but someone who does surgery on top of that. And Brenda?
Yeah, I majored in neuroscience, and then I want to go into family medicine. Yeah, I just wanted to get the intros in before we got too far. So
oh, definitely. No, thank you, Brenda. That was very clutch of you. Okay, sweet. So yeah, moving on. We'll go here. So yes, what brought you into the hospital? So what we learned to do very first thing, even before we learn about diagnoses, is just eliciting a story from the patient, because we want to learn about why they're in, what brought them in, past conditions, were you in pain? If so, where? And then like what helped, what makes it worse? somebody did mention medication and allergies. We want to ask about their support system as well. And like somebody brought up, can you afford it, or do you have trouble affording your care? That's very important. And that kind of goes in with what we call a social history, or where someone's from, the socio-demographic factors, their support system. So all of these are really important things, and it's a lot of information to get. So we won't be covering all of these today, but I think it's important just to have that in the back of your mind before you go into the room to see a patient. So it's go time. So you establish the timeline of your visit with your patient. So you would say, hello, I would say, my name is Apoorva Chowdhury. It's nice to meet you. So today I'm going to do a 30-minute interview with you where I talk about what brought you in and your symptoms and past medical history. And then I'll do a 10 to 15-minute focused physical exam with you. So we get a story from our patient. So I will read this out loud. And this just is kind of like a history that me or Brenda would write about our patient when we go into the room after getting all of that information. So 1 week ago, Mr. X was showering and suddenly felt an inability to breathe, accompanied by a sharp stabbing pain in his chest, which he described as a pop. He classifies the pain as a 9 out of 10 non-radiating pain, mostly localized to the right upper chest. Mr. X promptly called 911 and fell unconscious shortly afterwards. He suffers persistent episodes of SOB, which means shortness of breath, which are worsened by long stretches of talking and light physical activity. He also complains of a ringing sensation in his head after these activities due to lack of oxygen. So when I put in it quotes, it just means that's something that he told me directly. Inhalers and humidification treatments help to relieve his shortness of breath. Of note, Mr. X experienced a collapsed right lung 3 years ago after falling down a set of stairs. He was also diagnosed with COPD 10 years ago, which he attributes to his 50-year history of smoking. He has not smoked since his diagnosis and states that he had been compliant with his medication regimen of oxygen and inhalers prior to the event a week ago. And COPD is chronic obstructive pulmonary disease, so it's just a chronic issue with your lungs that makes it hard to breathe. A lot of times we see smokers that get COPD. So, any more questions or anything? So that's the history that we've retrieved. So great job retrieving your history. And now our important part is to do a differential diagnosis. So we want to summarize this Mr. X's problem into one sentence. So in this case, it would say Mr. X is a 75-year-old male presenting with sudden onset chest pain. There's a lot of things that can cause sudden onset chest pain. I'm not going to put you guys on the spot too much and try to, get some differential diagnoses out of you, but I will talk with you about some things that Brenda or I might consider when we have this. And a lot of times it's also, since we're in our first year, it's a lot of talking with our mentors, talking with our colleagues and our classmates, and creating this kind of differential diagnoses matrix together. So some of the things you might think of are a heart attack. So when we think about chest pain, a lot of times the first thing that comes to mind is a heart attack. Something else you might think about, a rib fracture. So maybe if he was in the shower or he had hurt himself or knocked himself, could have been because of that. And lung cancer even. This is obviously just a diagnosis that we don't want to miss, considering he's a little bit older and he has a history of lung conditions. This could be something to consider, especially with his smoking history. Pneumonia. So I think this is something we're all familiar with. A lot of times it's community acquired, but it can actually cause really bad shortness of breath that could have led to our patient who already has trouble with breathing becoming unconscious really easily. And last thing, which is an emergency diagnosis, is called a pneumothorax. So I've drawn a little picture here, but pretty much this is just word for like a collapsed lung. So if your lung pops for whatever reason, and the air actually escapes from your lung into your chest cavity, which can be really bad because it can start to move other structures in your chest cavity around where they shouldn't be moved. So that's something that we want to think about as well. Okay, I'm going to take a pause and see if we have any questions so far. I don't know, Brenda, do you see anything?
Let's see. Oh, there was a question. Could a blood clot cause this?
Yeah, that's a great point. So you're ahead of your years. So there is something called a pulmonary embolism that can cause shortness of breath. And it's actually It's kind of complicated, but essentially, yes, you get a blood clot and it gets lodged into your pulmonary veins and it prevents you from breathing. So that can cause somewhat similar symptoms, but yeah, we'll get into that. But that's a great part. I'll add that to my differential VNet. Anything else? If someone has sickle cell anemia, how is that cured? Oh, half my toenail ripped off. Oh no. Sickle cell anemia. Well, we can get into that later. So I will keep that in the back of my head and we'll keep going for now. All right. So now we're on to the physical exam. We're moving on. Let's see the chat. Could this be caused by fluid in your lung? Yes. So there's also, wow. I don't want to include all the differential diagnoses, but now you guys are saying them all. It's so exciting. So yes, a pleural effusion is something, it's a scientific word for having fluid in your lungs. And that could cause something like this as well. So in reality, we make these things called branching diagrams, which are like these huge matrices of like a bunch of diagnoses that could be considered just based off like one history. So these are all very good ideas that we can think about and we can add to our differential. And then the physical exam is what's really going to help us narrow down our differential. So very good, Bryn. Once again, beyond your years, I would have never even thought of that in high school. So I'm very impressed. Alrighty, so we're going to start with our physical exam. So a few things we're going to look at on our physical exam, and then we'll get into imaging later. So we're going to listen to his heart sounds first. Oh, no, I don't want to do that. Okay, we're gonna listen to his heart sounds. So Mr. X has a normal cardiac or heart exam. So just keep that in mind. We've listened to his heart, sounds normal, no murmurs. And then that's a little bacteria thing because Mr. X does not have a fever. So if we think back on the other differential diagnoses that we thought about, what might this rule out? This is kind of a tricky one. And I'll give you a hint, is that a fever a lot of times makes you think of something. Oh, we have chats. Pneumonia, perfect, yes. So pneumonia, it will help you rule out pneumonia because pneumonia is an infection. If you have an infection, you have fever, cough, chills, night sweats. So because he doesn't have a fever, we can rule out infectious causes. Perfect. Okay, and
everyone, welcome to our video on lungs.
Sorry. When you tap the edge of his rib cage with your fist, Mr. X does not show signs of pain. So this is actually a physical exam maneuver that we do to check for any tenderness on the rib cage. So if he's not tender, then what could that rule out from our differential diagnoses? Rib fracture, yeah, exactly. So it's gonna rule out broken ribs, exactly, perfect. Yes, so we ruled out our pneumonia. We ruled out broken ribs. He has a normal cardiac exam. So the last thing we're gonna do is we're gonna listen to his lung sounds. Oh,
this
okay.
Is it.
So I'm gonna move to 130 on here. Good. Okay, I'm gonna turn up my volume so you guys can all hear it. Okay, so when you listen to his chest, this is what you hear. And so it's kind of a spoiler, but this is, oh, excuse me. So this is what we call diminished breath sounds. So this is actually really cool. And if you go onto YouTube, you can actually hear a lot of different like normal lung sounds, crackles on the lung sound, but diminished breath sounds suggest something. And we'll get to that later. But when you go to listen to his lungs, they sound like this on the right side. So you know, okay, here's an abnormal finding. Now we have diminished breath sounds. Keep that in mind when you look at your differential again. So we're going to move on to his imaging. So this is a bonus thing because sometimes you get to meet the nurse there and they'll show you their medication list or they'll show you something special about the patient. So in this case, you get to see his chest x-ray and you see this little arrow and that's pointing at a structure in the chest. So what do you think it might be pointing? And this one's pretty hard, so it's okay if you can't get it, but if you can guess, that would be awesome. Lung. Okay, Mina, who are you? Girl, she's on top of things. Yeah, tumor, cancer, good. Any other, I guess I kind of gave it away because I was so impressed, but yes. So great guesses. This could be a mass, could be a tumor, and could be a cancer. And I will show you what kind of gives it away here. But first, I'm just gonna tap on this. So it is in fact a shrunken lung. So how can you tell? Well, if you look on the side that has the full lung here, which I've traced out, I don't know if you can see there's little vessels. There's little pieces of vascularity that kind of extend from the center. Oh, sorry guys. And so those extensions tell you that that's where the lung, you can trace out to the edge of the lung. However, here, if you look past this area that some people could think was a mass, cancer, tumor, which all are very valid guesses. However, the thing that gives away that this is a lung is if you look outside of it, you don't see any of that vascularity. So no vessels extending. It's more dark. It's less gray. So that grayness is created by air, but in the lung and the vessels and some fluid. But if you don't have that all, then it's just you just see the bones and the spaces between the bones very, very clearly. So yes, so that would be a shrunken lung. And then if you're curious, the structure actually underneath the left lung here would be the heart that you're seeing down here. And then down here is the diaphragm, which are these two little cushions underneath the heart. So any questions about that? Any questions about our scan? Okay, good. All right. So yes, so you get to see a little imaging bonus. We don't get this all the time, but I think this would help you kind of narrow down your differential more. So now we're gonna get to our final thing, which is you come back. So you've shown your physical exam findings to your mentor and everything like that. And now you're gonna ask, and I will set a poll up. What do you think could be causing Mr. X's symptoms now that we have all of our findings here? And you can go ahead and vote. I lost me here. Good. Okay, I'm gonna give it 5 more seconds. So just go ahead and guess. There's no pressure here. 5, 4, 3, 2, 1. Okay, I'm gonna end the polling. Yeah, so can you guys see the results? I think I'll share it. So it says that 81% of you chose pneumothorax, 15% chose lung cancer, and then a little bit of pneumonia. So great job. So it looks like a majority of us said pneumothorax, and that is the correct answer. So in this case, he did in fact have a collapsed lung, maybe caused by a puncture, or because he had COPD, his lungs were already weak. And I have a little graphic here. Oh, there we go. That talks about what a pneumothorax is. So by no means do you have to read all of this. It's okay. But if we look at this little causes area right here, you can see primary and secondary. So a secondary is probably what our patient has. So he had a secondary lung disease because he had COPD from his smoking, which made his lungs weak at baseline. And I don't know if you all caught this, but actually he has a history of this. So this happened to him 3 years ago, which hints us again at this possibly being another pneumothorax. The symptoms were shortness of breath with acute chest pain. And then the pathophysiology you can read, but it just like I said, air enters this area where your lung is, and it can put pressure on your lungs, your trachea, your heart, and other structures in the area that are really important. So it can mess with their functioning. And the treatment would be a needle decompression, which is essentially just putting a needle in and taking the air out of that space so you don't get any more of the structures being compressed. So let me check was the lung that collapsed? Yeah, I'm actually not sure, Bryn, so that would be a great question. Let's see, how could his lung have shrunk? Well, pretty much the lungs are just, you can think of them as these balloons. So they're holding air and they expand and they deflate and they expand and they deflate. But if he had some reason that his lungs got punctured, and this can honestly happen spontaneously, and in this case, it was spontaneous and he had a secondary, so it was lung disease that he had, COPD. So his lungs ruptured, and when they puncture, it's like air leaking out of a balloon. So the balloon shrinks after you poke it with a pin or something. So it's kind of the same thing. Yeah, so I'm not sure if that was a lung that collapsed 3 years ago, but that would have been something helpful in your HPI. You can go back to the patient and ask him that as well. And let's see, any more questions? I'll check the Q&A. Yeah, no, but that was your first hospital morning and you all did fantastic. I see another question. Let me just check it. What would happen to the lung afterwards? Do they remove it or keep it there? That's a great question. Brenda, you want to answer?
Yeah, usually once you they will put a tube like in the lung to help air like leak back into the lung, and then it'll expand and close back up, and it'll be functional.
Yeah.
Yeah.
Any more questions before we finish up? Yeah. So this is something that if you catch early, it's a good thing. You know, we got him to the hospital, he got treated, and he should be able to make a full recovery from the pneumothorax itself, not necessarily from his chronic lung disease, but that's something that now he knows to look out for in the future. So great job, everyone. We finished our first hospital morning together, and you all did a fantastic job making a differential, knowing what questions to ask the patient. So honestly, some of those questions and comments were really beyond what I was even expecting. Ryan Flanagan, why would his heart rate be normal if a symptom is increased heart rate? Yeah, so his heart rate, we take the heart rate when it's in the hospital. So he's already hemodynamically stable, just meaning that when he comes into the hospital, we've stabilized him, we have the tube in place. So his vitals would have been stabilized by the time that we as students go see the patient. So in terms of like when his lung actually popped, his heart rate would have been risen quite significantly. But by the time we see him, his heart rate is normal, but he'll still have some of those diminished breath sounds that we were able to hear the first time around. Good question, Ryan.
Yeah, it looks like there was another question about does the lung heal by itself or need closed? I'm actually not sure when they take out a chest tube. I think they probably stitch it up. Do you know? Yeah. Okay.
Yeah, they will stitch it up afterwards and then it should heal.
That's what I thought, but I didn't want to like just say that and be like, yeah, that's what happens. Giving you guys faulty information. Okay. Are we any other questions before we move on to more the career focused aspect of the presentation? Alrighty, I will go ahead and share my screen. Hopefully you guys are seeing that. So for this little part, we're just going to talk a little bit about career exploration and what that looks like for you guys as you're going into like college, and even like right now, what you guys can do to figure out what you want to do in the future. So our first thing, I wanted to do a poll, and if you guys could respond, I'll read the polling options and then I'll launch the poll. So please respond with which one you identify with most. So A is I have no idea about I haven't put much thought into my future career options, but healthcare could be within the realm of possibility. Or B would be I am vaguely considering going into healthcare, but still have a lot of questions and possible other career options. C would be I'm pretty sure I want to go into healthcare, but I'm not sure which specific career I'd like to pursue within healthcare. So that could be a doctor, a nurse, a physician assistant, a nurse practitioner, social worker, pharmacist, etc. And then D would be I'm pretty sure I want to go into medicine specifically. So let me see if oops, sorry guys. Oh, how to do this. polling. Already launch poll. All right, go for it. Nice, we're getting a lot of responses. I'll give everyone 5 more seconds to respond. So 5, 4, 3, 2, 1. Great. End poll. And I'm going to share the results with you guys. So it looks like we have about like 55% of people who are like pretty sure they want to go into medicine. And then C, we have like 35% of people who are pretty sure they want to go into healthcare, not really sure exactly where they want to end up with. And then we have 6% of people considering it, not really sure. And then 3% still a little bit more unsure. So with that, thanks for responding to that. I do want to talk, we're going to move on to talking about kind of the steps and, okay, sorry, 1 sec. Okay, there we go. The steps to like getting to where you want to go in medicine. And this is specifically from the AAMC, and it's just a kind of a roadmap starting with your college freshman year all the way into starting medical school. What they recommend you do like during certain times in your college career. So if you look at your college freshman year to your sophomore year, we'll talk about that a little more in depth. So that's mostly focused on getting experience and exploring what your options are. And then in your sophomore year, you would kind of continue looking at what you want to do, looking at your majors and trying to figure out how that all fits in there. And then maybe start thinking about the MCAT depending on what you want to do. So the MCAT, for those of you who don't know, is the test you take before you go into medical school. It's everyone has to take it, and it's a way for the admission. It's kind of like the SATs for college, but for medical school. And then kind of going into your junior year, you can talk to your advisor and start thinking about when you want to take the MCAT exam. And then during your senior year, you can start maybe start your application and continuing with your volunteer work throughout this whole process, and as well as like talking to your professors about getting letters of recommendation and everything like that. And then after your college, after you graduate college, then you would start looking at interviewing and what that looks like as far as acceptances go. I do want to make the point that this is just like a very cookie cutter, like if you went straight from college all the way to medical school. I know a lot of people have things in between like college and medical school, things that they do. Like I took a year off and worked, which was great for me. So I want to emphasize that this is not what everyone does. And like there's a lot of different ways to get to medical school and a lot of different ways to find your career path. But with that, I will go ahead and jump in. And if there's any questions, Apoorva, if you see them, could you just interrupt me? And yeah. Anyway, so I will go into a little bit more depth about what your career exploration looks like right now. So this kind of starts at college freshman year, but you can really start whenever you want, because I think the sooner you start, the easier it is when you're getting into college and you're starting to really think about this stuff. The more experience you have with a lot of different things makes it easier for you to make a decision. So as far as exploring your options for careers in medicine, they talk about visiting aspiring docs, meeting with your advisor, attending pre-health meetings, looking at summer programs, and then exploring financial aid options. So with that, I think it's really just important to be involved with whatever you can and find ways to meet people that have similar goals as you and work with them as well. I think that has really helped me. And then you have your summer and then getting experiences. So participating in enrichment programs and volunteering or interning in fields. So one thing that I did in my college experience was a thing called Healthcare Alternative Spring Break. And so during that, during spring break, we went to a rural town in Washington and got to shadow physicians for the week. And then we also went into high schools and we were able to present about like the college application process. I think that was really helpful for me to figure out kind of the different options for me going forward. And it was a great way to do some career exploration built into my college time. So yeah, that's just one plug for like an example of what you can do for career exploration. Any questions right now before I move on? Okay, great.
There is one question, Brenda. So Emily's asking, what if you are in Running Start and have already completed your first year of college, quote unquote? I will say that I think that's okay. I think whether you're in your, actual first year or it's going to be your second year, I don't think that it's necessarily required that you really get in depth into volunteering or like lab work or research until I would say start looking at like the end of your sophomore year. And I think junior year is when you kind of want to hopefully get more involved with that. Is there any way to skip college altogether and go straight into med school? So I'll address Emily's question, just finish that up. Yeah, so I think it's okay. I think the most important part is before you even do any of that, just get some exposure, go to clubs, do some volunteering, like clinical volunteering, shadow some physicians if you can, and really just figure out what aspects of medicine really appeal to you. And even what things, like if you shadow a doctor in a specific specialty and you don't think that's for you, it's okay. And med schools actually really look for that because it shows that you've done a lot of exploration. And so yeah, you're okay, Emily. No worries. No worries. Brenda, do you have anything to add on to that?
Yeah, I was just gonna say that with Running Start, you do have to kind of start thinking about your major earlier, just because you'll have those 2 years in. But I think that also gives you a lot of opportunity to like get ahead with your college, and then if you want to take some time in between college and med school, that gives you time there too. So it's definitely like you just kind of want to get as much exploration as you can before you really make a decision. That's what I would say. And were there any other questions? I know.
So I was just gonna type. So Myra is asking, is there any way to skip college altogether and go straight into med school? I don't believe so. However, I will say, when I was applying, I saw some colleges that if they're affiliated with med schools, they'll actually have like 7-year programs, or 8-year programs where essentially, as long as during undergrad you maintain a certain GPA and you get a certain MCAT score, you're guaranteed admission into their medical program. So I know Wazoo does something like that. I think there's a few other medical schools that do something like that. So if you're interested, I definitely check out those. But I don't think that you can just skip college altogether, unfortunately.
Yeah, I have seen it where they integrate it a little bit, but yeah, like that. I don't think you can if you're gonna do it the like I quote unquote traditional way, you kind of have to have a degree or be working to get a degree by the time you apply.
Yeah. And one last question from Sophia. Does a summer med program count as some experience? I would say sure. And it just depends, like if that's research, if that's clinical, if that's leadership, then it would definitely count as some experience, especially if it's during like your college summers.
Mm-hmm.
And even I think during high school, if that can like propel you into some other opportunities, that would be really great as well.
Yeah, I think anything that gets you exposure to something you're interested in is a great experience. So, yeah.
And Brenda, I'll let you keep going and I'll just stay on the chat and answer questions as they come because I don't want you to get too behind.
Okay, sounds good. So as far as career exploration goes, what do you do? Volunteering is a great one. So this doesn't have to be healthcare related. You can find something you care about and dedicate time to it. And an important thing is valuable experiences are ones that are going to help you learn and gain a new perspective about life or yourself or anything along those lines. So some examples could be one thing that I did in college was I volunteered at the homeless shelter um, it was like for homeless youth, and I thought that was a really great experience to just meet new people and gain a new perspective. Also, so another thing would be shadowing. I think most medical schools require that you do some sort of shadowing. I know this can be kind of a difficult area for some people if they're not like connected with the medical field. But if you talk to your advisor or get involved in clubs, usually you'll find a way to get hooked up with someone to, or even just like if you talk to your doctor and be like, hi, I know people who have done that. Like, do you have any ideas for how I can get shadowing experiences? So yeah, and then seeking mentorships is a big one. I know most people, or I know when I entered college, I had no idea what I wanted to do, and it was really helpful having people who had done it before me, who could speak to their experiences, and then kind of light the path for me as I went through. So that's those are some really great ways to kind of explore what you want to do and also gain some guidance as you go along. And then continuing to talk about this career exploration topic, one really important thing is seeking out leadership opportunities. So this can be in any club or activity you're involved in. If you're someone who doesn't enjoy like being in front of people or maybe being in charge of a lot of things, I would really encourage you to find a way to like stretch yourself. I think you want to find this happy medium of where you're uncomfortable, but you're not panicking. And you're not bored as well. So I would really encourage you to take time and find experiences that are going to stretch you and help you learn, but also don't make you exhausted or make you feel like so uncomfortable you can't function. A little bit of discomfort is good, a lot is not. And then with those experiences, any experience you have, take time to write about what you're learning about yourself along the way. And really just take time to reflect about what you think you got from each experience. So yeah, is there any questions we should answer before going forward?
Hi, I've been answering a few, but I see one that says, as a sophomore in high school, I really want to become a surgeon. By chance, should I start learning more about the anatomy and health/medical to get started? What do you have to say, Brenda?
Yeah, I think that's an interesting question. I think it helps, but I think it's also important to be a well-rounded person going like as you're preparing to be in medical school. So if you're interested and you want to find an experience that'll help you learn about anatomy and all that stuff, I think it's those can be really valuable. But also take time to like explore other options and learn about yourself. And yeah, that's what I would say. Do you have a reply to that, Apoorva?
Yeah, definitely. I think one of my friends told me like medicine's all about learning things and then forgetting them and relearning them, which is like a huge part because in undergrad you'll learn things and then you'll relearn them in medical school and then you'll relearn them on clinical rotations. So if you want to study anatomy and that's just something that you're passionate about, I think that's totally okay. But if you're already overwhelmed with like classes, then you don't have to go out of your way to study it, because I promise you'll get exposure in undergrad if you'd like. And then you will probably forget it after undergrad and have to relearn it in medical school again. So if it's out of interest, and that goes with like anything medicine related, definitely go for it. I used to do a lot of reading when I was in high school, but I wouldn't say that that's like essential to getting into medical school. I think they more so look for if you're a good applicant with your kind of qualities like leadership or your clinical experience, or how invested you are in the field, versus like how much actual knowledge that you have about like anatomy and the sciences.
Yeah, I think that's a great point. Do we want to answer more questions, or should we move on?
I think we can move on for now, but yeah, feel free to type your questions in the chat as Brenda is speaking, and I will let her know if anything comes up.
Thanks. Okay, so that's actually a perfect segue into talking about what you can do now to prepare as far as academics go. So one thing that I didn't really think about until I was in college was thinking about my learning style. So as you can tell, there's a lot of different ways to learn, and it's really helpful to try each one out, or I know they have quizzes online that help you understand how you learn best. And I think that's really helpful as you going forward with college, where you're a little more independent and the learning is more your responsibility. It's helpful to know how you learn, so that when it comes time that you have to do it, you can do it the best. You can be efficient with that. So another thing is developing habits that will be useful. So understanding how, like, ways that studying fits into your life, and what types of studying works for you. I know some people like to listen to podcasts, so you can they have podcasts where you can like listen to lectures, or I know some people do really well with flashcards, so maybe taking time to figure that out. I, for one, have to like write everything out, and that's how I learn. So that's been really helpful to have that in the back of my mind as I'm trying to learn. And when there's not always resources there for like trying to try like built into the curriculum, it's better if I can like just do it myself and do it that way. So also another important habit that I think is really good to have in your mind is finding ways to take care of yourself. So things that excite you outside of school, outside of medicine, that you want to take time to do can be really important as you go forward. It's easy to get burnt out on all this stuff. So if you can think of ways that, like playing guitar, or doing exercises, or baking. I know a lot of people who stress bake. That can be really helpful to have those habits in place when you come into more stressful situations. If you have that already built into your life, it makes you become more resilient. So and they'll definitely ask you about that as you are in the application process. They'll ask you ways you've built resiliency into your life. So that's not just, it's an important aspect of your life and your development. So yeah.
Hey Brenda, there's a few more questions here.
Mm-hmm.
I kind of answered Sophia's already, but she was just asking if either of us volunteered in a hospital or worked in one before medical school to get experience.
Mm-hmm.
I already answered my part, so if you wanted to kind of say something.
Yeah, I volunteered as a health scholar at Swedish Medical Center, which was pretty valuable. I would say it really helped me gain like an idea of the kind of patients I wanted to learn about. I also worked as a scribe for my year in between medical school and undergrad, which I thought was really helpful as just to learn some of the lingo that goes along with medicine. There's a lot of different words and vocabulary that you kind of have to pick up on, and so I thought that was really helpful.
Sweet, a few more. So Cassandra asked, did either of you guys start off with scholarships? Brenda?
Yeah, as far as scholarships go, I was lucky enough to have a lot of scholarships during my undergrad, so that was helpful. And then there are also scholarship options for med school, which have been nice. I think one thing is about medical school, there are a lot of options for ways to pay. Like you can do the military, or I know underserved areas will help you with that, with paying for it. So there are a lot of ways to support yourself, and if you're someone who wants to avoid going into debt, there are options. Do you want to speak to that a little more?
Yeah, I got a small scholarship before college, but not really otherwise. But there's definitely, even if you're not getting it through the school, there's independent ones that you can apply for that you just kind of have to seek out. And like career advising knows a lot about that. Your pre-health advisors will know a lot about that. So definitely reach out to them and they'll connect you to opportunities. We have a good flood of questions coming in. So Bryn is asking it be stressful. Bryn, I will get to your question. We can save that one for a sec. Does being a part of a sorority help on medical school applications? I have plenty of friends that were in sororities beforehand. There are like just general sororities, which yes, because you can get really good social experience and leadership experience through them. And there's also like pre-health specific sororities that are at least the University of Washington has a few of them, and those are actually really great because they can create both leadership opportunities and they have a lot of support networks, like some shadowing networks and things like that. So those can help you get a lot of connections. And Brenda, I don't know if you wanted to speak more to that.
Yeah, I was in a sorority in undergrad, and it was really helpful. It was an experience I could talk about as far as like because you get to be involved in a lot of like community-based things and experiences with that. And then also there are a lot of leadership opportunities in a sorority usually. So I think it's a great way. You do have to just be mindful of your time, because I know there's a lot of time commitments with that. So just being intentional about what you dedicate your time to is important. Yeah.
So I just was replying to Myri, but she said, is there any good lectures or studies online that you can use? For undergrad, I said I liked Khan Academy a lot personally because there's not a lot of free, really accessible ones outside of like, the education that you're paying for. So Khan Academy was great for me personally, Brenda. I don't know if you use anything outside of that.
Yeah, I also use Khan Academy a lot. Yeah, that would be my number one thing. There aren't a lot of free options out there for that.
And I think for med school, there is a lot of like paid services that I think are worth it. But I think for undergrad, I think Khan Academy was more than sufficient on top of my normal class materials. Okay, one sec before I Bryn, I answered her question. Did you both get good SAT scores? I'd like to think so. I actually did better on the ACT than the SAT, so that's the score that I used, Brenda. I don't know.
Yeah, I mean, I think I did okay. I honestly don't remember. It's been a while.
Yeah. Like a really wide range of like acceptances that they take, but I feel like for you guys the SAT is kind of going out of favor now, like standardized testing, but I'm not sure. One last thing about how many days a week are you guys going to hospitals? So 1 day a week early. So like if we have a 2-week schedule, we're going in 1 day a week for hospital morning, and then we're going in a second day the next week. That's not actually going into the hospital, but going into our primary care preceptorship, where we're also seeing patients for 4 hours. So that's what I would say about once a week. Brenda, you want to add?
Yeah, I think I probably see patients once a week at least, which is great. It's a great way to get some experience. And then once we get done with all of our in-class work, we'll be in the hospital or clinic daily. So that's something to look forward to. Yeah. Any other questions before we move on?
We're okay for now.
Okay, great. So this is just an example that Apoorva put together that she made for like while studying the human microbiome. So this is just an example of like different tool, like it's a word map you can use that she has perfected. I don't know if she wants to speak to that a little bit more.
Yeah, so like I realized I was kind of a visual learner, so this is something that really helps me organize my thoughts and go back to for review when I study. So this is just one example of like learning modalities, because obviously some people look at this and they're like, oh my God, I don't think I could even like map something. Obviously it's easier when you make it yourself, but this is just something that like kind of shows an example of what a visual learner might do in order to like better kind of condense material for themselves. So yeah.
Thank you. And then as far as taking time to reflect, I put kind of like examples of questions you could ask yourself and respond to. So like, what excites you about going into healthcare? And then maybe what are some things that concern you about going into healthcare? So if you guys have like a journal, or I know a lot of people have moved to like typing their journals out. That can be really helpful, especially when you start going through the application process, being able to look back and read what you've written, and then use that for your applications. So these are just two questions that I thought were ones you could use as you start thinking about what you want to do and exactly why. So being able to come up with good reasons for why you want to do what you want to do is really important. And then we'll go ahead. Oh, this is perfect. What questions do you have? So I'm going to stop sharing and we'll just respond to any questions that come up.
Yeah, Brenda, and there was one question about watching a surgery, or like when we get to watch surgery. So I answered mine because I actually got to see some before med school when I was shadowing, but I don't know if you wanted to speak to that.
Yeah, I mean, I've gotten to watch a couple C-sections, which has been great in medical school, which has been really awesome. But before medical school, I didn't get a lot. I didn't get a lot of like watching surgery experience. I did spend a lot. I spent a lot of time in the clinic, which I thought was pretty valuable. But yeah.
Yeah, and I think like if it also depends, because I worked in a scribe in ophthalmology, which is more of a surgical specialty. So I did get to go into the OR a lot more, or the operating room a lot more. But obviously it just depends on like what kind of physicians you're shadowing and what specialty they're in and things like that. So that's kind of what I would say. And if you really want to do surgery, maybe look into getting in touch with physicians that are in more surgical specialties. Is it possible to work while I'm in medical school? I would not think so. I don't know, Brenda, what would you have to say?
I think you have to be really good at managing your time. I have not met anybody in our class that works during med school. Yeah, it's kind of a full-time thing. As far as we showed you guys the schedule, and usually what I do like during the day, I'll spend the time when we're not in class, like studying and preparing for the time for our class time. So it's kind of hard to balance, but if you were to try and add a work onto that. So yeah.
Mina says, I am part of West Valley. Oh, and I know it is 4:30. So if anyone has any additional questions, I think, Brenda, do you want to put our emails kind of in the chat?
Yeah, I can do that.
And you can feel free to email Brenda or I if you wanted to, because I feel bad for keeping you all later than you would like to be. There we go.
Nice.
And Maria, if you wanted to come in for a sec.
Yeah, just to speak to everyone's questions, I've seen a lot of people asking like if we're going to do one of these again or another one. We don't have another specific like business after school scheduled. This was kind of going to be our last one for the season as schools start to wrap up. But if this is something, especially if you are a teacher who's maybe asking that and is particularly interested for your class in specific, or if you just know like a bunch of kids who wanted to come but couldn't come at this time, please feel free to reach out. We do love facilitating these and hosting them. They are, a decent amount of work, especially on our presenters' part. So we would need to make sure that it would be, a larger group, to be able to come in. But if this is something that you're interested in having happen again before the end of the school year, we really plan to have an in-person one of these, hopefully down at UW, downtown, come the fall or the spring, depending on how everyone's schedules look like. So that will for sure. At this rate, assuming kids are back in class, which is kind of the metric we're following, and the schools are comfortable with it, we will definitely be doing some more in-person workshops come the fall. We don't do these over the summer, just to respect people's schedules, of course. But I'll put my info into the chat. I'm pretty sure y'all have it because I sent out the registration link as well. But please do feel free to email me to just let me know if there's interest or specific interest or specific things in general. And it's something we're more than happy to work with UW to attempt to facilitate, as much as we can help students and reach students we want to. But we also don't want to put on things that people don't want to come to or don't have time to come to. So please feel free to reach out and we can definitely talk about getting more of these scheduled at some point.
Sweet. Okay, I think we'll do one last question, which is what I see from Nina just asking about what undergrad, what is one major thing I should tell them about going into medical or undergrad school? Wow, this is kind of a loaded question. This is a good wrap-up question. So Brenda, if you have anything that you want to add, and then I can go ahead.
Yeah, I would just say that as far as medical and undergrad, it's definitely not, it's something that everyone can take their own path to. It's like, take your time, figure out exactly what you want to do, and then don't be scared about like, oh, this is going to take me so long to get done, or like, I just want to get it, like, start working. I think if this is something you really want to do, it's worth the time and effort to put in. And yeah, that's what I would say.
Yeah, definitely. I would say it's like a long journey, but it's really important to kind of get exposure to those pillars of clinical experience, of volunteering, of shadowing, and of leadership. I think those are the 4 main pillars that you want to immerse yourself into. And after doing so, just decide if that's really something that you want to pursue. And I think once you've touched all of those pillars and you really feel still like passionately about the medical field and have gotten a lot of exposure, then I think that that's really telling of, you have this passion and fire and you should definitely pursue it. So I would say it doesn't hurt to get started early. It doesn't hurt to get started late. Like Brenda said, everyone has their own path. Just make sure that you're really getting all of that exposure beforehand. Perfect. Alrighty. Well, thank you.
All right. Yeah, I think we'll wrap it up here just to respect everyone's time. They put their contact info in the chat and I'll make sure to put that in the follow-up email as well. And like I said, in that follow-up email, this recording will be in there. Feel free to use it, share it, however you need. It'll be posted on our Business After School website as well, shortly following the email, should you lose it. And as always, you can reach out to me with any questions. And people are asking, so I will just ask this really quick to make sure if it's okay to email either of you with questions about med school, if you're comfortable with that. So it looks like thumbs up all around, which is wonderful. So thank you. Yeah. And as always, any questions you guys may have, feel free to reach out to me as well. If I don't, I'm the master connector. So if I don't know the answer, I will connect you with someone who does. And thank you all for your time tonight and for hopping on here with us.
Thank you. Head out now.
Bye.
Thanks, Maria.